One of the projects I have right now, my husband's going to help me to get an after hours pickup box for medications and things set up outside the clinic so that when people need to pick something up because they don't get off work until after hours, can do so with a combination specific to them. They can come by and pick up whatever it is they need. In a lot of those cases, this one in particular for the diabetic, they weren't able to come by and pick it up. And they said, well, I just don't know. We always are working while you're working. I don't know how we're ever going to pick up our medication. I said, well, I can deliver it to you. It's like, I'm looking at your address on your chart right now. I said, you live near the junior high where I'm picking up my son at 4 o'clock, after school's out. I said, I can just drop it in your mailbox if you want. And sure, so, just the little things like that that people don't expect. And because you're working with people like they're your neighbors, and because they are, and to be able to do that and drop that off and make sure he's got access to medicine, as well as just knows he can contact us if he were to ever become ill again, and potentially save his life.
If you were in traditional practice like a year ago, you probably never would have offered that to do that. I mean, because you were so burnt out from the day of seeing 25, 35 patients. You're like, you know what? I'm done for the day. Or you would have never started an IV a year or 2 years ago.
Right.
You're just not going to deal with that kind of stuff, which really in reality, I mean, like you say, it adds some flavor to your life, to your practice. I mean, it feels like you accomplished something by starting an IV, even though, you might not have to as a doctor do that in some situations. It's still cool that you can.
Yeah, it does. It lends to just, the reason we went to medical school. Everybody, it sounds really corny, but we go to medical school a lot of times because we want to help people. And you don't feel like you're doing that anymore whenever you're just being shuttled from one room to the next, seeing people in, 5 to 10 minute increments. They're on the schedule for 15 minutes, but you're not going to see them for that long because you still have to document, as best you can before you move on to the next person. So you don't get to know your patients as well. You don't get to do it as much hands-on type of care. That's why a lot of primary care doctors don't do procedures in their office. They don't have time. So, if you need a skin biopsy, well, we'll send you to see the dermatologist. If you need, whatever, a toenail taken off, we'll send you to see the podiatrist. Those are things we're trained to do, but we just oftentimes don't feel like we have the time to do them. And in this system, I can offer whatever procedures I feel like I enjoy doing, either as a part of my membership or at whatever honest cash price I feel like I would set for that, and then let the market determine whether that's something my patients feel like is valuable.
Well, I mean, back in the old days, family practice doctors, I remember the doctor that delivered me in 1970. He started practicing in the 60s, small town Othello. I mean, he did appendectomies, he did C-sections, he did orthopedic surgeries.
Right.
I mean, he did eye stuff. I mean, everything. He did it all. I think with some of these direct primary care practices, you're starting to see some of that now where they do more things. I mean, when you have just a simple break, and I know I'm making this sound, too generic and too simple, but when you have just a simple break in a wrist or an arm and you just need casting, do you have to go to an orthopedic specialist if it doesn't need to be set? Probably not.
Yeah, and oftentimes in kiddos, a very minor fracture oftentimes doesn't even need a cast, and just to monitor that, keep it splinted, and recheck an x-ray later. And that's been kind of liberating too, is, I've been in my community for such a long time. I know all the local specialists and things. I've got their numbers in my cell phone and things. And so they are wonderful, resources to send a question to. One of our local dermatologists is great. One of the cool toys I've been able to invest in since becoming in direct primary care is a dermatoscope. And that allows me to look at skin lesions in a lot greater detail, and I can take pictures of them. And so I have been sending her more pictures and saying, hey, I saw this in the office today, and what do you think? I was going to biopsy this, or do you think I should send this? Or, these are my biopsy results. Should I send this to you, or does it need to go to a Mohs surgeon? So it allows me to interact with my colleagues more. Whereas before, you might say, well, just you tell the office staff, forward these records to so-and-so, but you never have that collegial interaction. And I've been able to do that more. I have the time to reach out on patients' behalf to their specialists and things. So it's rewarding in a lot of ways I didn't anticipate, as well as the ways that I had hoped. So I couldn't be happier.